Hello, everyone, and thank you for joining our presentation on person-centered language. My name is Audra Thompson-Haile, and I'm a project manager with the Ontario Centres for Learning, Research, and Innovation in Long-Term Care, hosted at the Research Institute for Aging in Waterloo. Today, I will be presenting with my colleague, Tina, from Behavioral Supports Ontario.
Hi, everyone. My name is Tina Kalviainen, and I am the Strategic Communications Specialist with Behavioral Supports Ontario's Provincial Coordinating Office.
So before we tell you a little bit more about person-centered language, we wanted to acknowledge that this initiative has been co-developed by BSO and the Ontario CLRI with support from an expert panel. And what we're going to do today is give you a roadmap of what we're hoping to accomplish in today's presentation. We're hoping that you leave today with an understanding of how using person-centered language can improve the quality of life of residents and long-term care team members. We're also hoping to give you some simple ways to change language and start using person-centered language immediately. And finally, we'll teach you about resources available at no cost and learn how you can share and promote them within your long-term care home. We're going to do that by walking you through what person-centered language is and why it's important. Tina will give you a history of the project. We'll share the various resources that are available and where to access them. And then we'll give you some next steps on where we're hoping to go with this project. I wanted to start by introducing you to Charlie. Charlie was my grandfather. He was born in England, fought in World War II, lived in India and North Africa before immigrating to Canada in the 1950s. He came to Canada with nothing more than his 2 daughters and his wife and worked as a strawberry picker. Later, he got a job as a machinist and then worked for Canadian Valve. As Charlie grew, he bought a house, worked hard, traveled extensively, became an avid golfer and baseball player. When he was in his 60s, he suffered from a rare virus that left him vision impaired, but this didn't stop him. He joined a blind lawn bowling club and began traveling across Canada participating in tournaments. When Charlie was in his mid-80s, he had a few small strokes and his memory began to fade. He later moved into long-term care. I want to pause this story and ask you to spend a few moments reflecting on the following question. What do you think of when you hear the word facility? I invite you to write down a few answers or take 10 seconds to just think about some answers. As we are recording this, we can't follow up on your live responses, but we can share some of the responses from past presentations. When people hear the word facility, they often think of words like institution, drab, dreary, lonely, things that are really not seen in a positive light. Similarly, let's do the same activity. I invite you to reflect on the following question. What do you think of when you hear the word home? Responses that have been shared in the past when we asked groups this question were warm, family, safe, comfort, love, comfortable. I've just shared information about my granddad and his life. The purpose of this was to give you some context of what a well-lived life might look like, and to make you think about how this person would feel if they knew they were moving into a facility versus how they might feel when they learn that they're moving into a long-term care home. As a collective, for a quick win in person-centered language, we can agree that choosing to use the word home rather than facility is a much more person-centered language choice. We aren't striving to be the language police, but we want to be aware of the impact that words can have on our well-being.
In an effort to include you on where we are headed, We would like to take a moment and reflect back on where we have been as a person-centered language initiative. In 2016, various stakeholders took part in a think tank session, which was co-led by the Alzheimer's Society of Ontario, ASO, and Behavioral Supports Ontario, BSO, where participants were invited to discuss both current and future states of communication and language used in reference to dementia and persons living with dementia. What followed was BSO's Provincial Coordinating Office being identified as a change agent that could play a valuable role in leading such an initiative and also weaving the work across a number of sectors. A partnership between ASO, BSO, and the Ontario CLRI at the Research Institute for Aging was struck to move this work forward. In 2017, an expert panel comprised of representation of the lived experience were instrumental in the creation of our 4 person-centered language commitment statements. Our toolkit report was released in 2018, and 2019 saw the delivery of multiple presentations in the form of webinars, workshops, and at conferences as a means of transferring knowledge within a knowledge to practice process framework. Which brings us to the present and our newest collaboration with McMaster University in the design and development of person-centered language e-courses, which we will discuss further in later slides. The expert panel's purpose continues to be to promote the consistent use of person-centered language that is appropriate, respectful, life-affirming, and inclusive when talking with and referring to older adults presenting with or at risk for responsive behaviors, personal expressions that may be associated with dementia, complex mental health, substance use, and/or other neurological conditions, and their care partners. Now, why do we need person-centered language? Well, we believe that everyone, and by everyone we can speak to team members, partners in care, family, friends, volunteers, and students, everyone can access their choice of language and play a supportive role in reducing and eliminating barriers that are associated with such things as stigma and discrimination, stereotypes, labels, and prejudices, misunderstandings and misconceptions, feelings of shame, guilt, fear and distress, social isolation, and negative, inaccurate, and misleading portrayals across society as a whole. Consistently using person-centered language has the potential to increase the likelihood that individuals will open up and share personhood facts and symptoms being experienced, pursuing a timely diagnosis and putting those supports in place, leveraging existing strengths and abilities, living at home and staying involved in the community and at work as long as possible, active participation in research, increasing that quality of life and well-being, create understanding through education, promote positive views in mass media, and ultimately have those discussions around health promotion and prevention. Here we have a clip of Dr. Alan Power sharing his wisdom on the power of words and how documentation can infect a team member's mindset and approach.
To illustrate the power of words and our nonverbal demeanor, I often use an example when I'm working with care staff around a very simple word that doesn't even sound particularly judgmental, and that is the word refused. Our national guidelines even say that residents have the right to refuse medications or treatments, so it's actually written into our code. And yet, even that word can have some subtle messages. I often ask care staff to imagine that they have had to move to a neighborhood where they don't normally work and provide care for someone they've never met before. And let's suppose that that person decided that she did not want to take her bedtime medication. We don't know for sure why she didn't want it. Maybe she had a stomach ache. Maybe she was asleep and didn't appreciate being woken up. Maybe she was confused about the pill and wanted to talk to the doctor before she took any more doses. But for whatever reason, the nurse dutifully took the medicine back because the person does have the right to say that they don't want a pill. And in the chart, she documents resident refused HS medication. Now, if I'm a carer coming on the shift and I'm going to go provide care to that person, I often ask people to think, when you open the chart and read resident refused HS medication, what kind of a person do you expect to meet when you walk in the room? I've asked this question on 5 different continents, and I get the same answers from different countries all around the world. I would expect someone who's difficult, someone who's argumentative. I would go in there expecting a fight. And what does that do to your body language when you walk up to a person with that in mind? So even a simple word like refuse can actually poison the relationship we have with a person before we even meet her for the very first time.
Following Dr. Power's example of the potential effects of reading a chart prior to providing care, we wanted to share this article which states that there is growing evidence that language used to communicate in healthcare reflects and influences clinician attitudes towards their patients. That medical records, documentation are an important and overlooked pathway by which bias can be propagated and transmitted. That it's important to use neutral, non-judgmental language in patient narratives. And in conclusion, that reflection on the use of language in a chart seems like a very promising point of intervention. And so though it is important to consider what we say and how we say it, we also need to think about what we write and how we write it. And that language should be specific and descriptive rather than using labels. To anchor what it means to apply person-centered language, we will now go over the 4 person-centered language commitment statements. In case you didn't know, we do have several self-reflection questions for you to consider that are part of the person-centered language toolkit. A link to the toolkit will follow in upcoming slides, and you can always find it by Googling person-centered language report. The first statement is to see the person first. I will focus on the person's holistic well-being by respecting the role of culture and other influences such as personal experiences and the environment. One of those self-reflection questions includes the following. Is the environment mainly or more than physical surroundings? When we mention the word environment, do we tend to focus on the physical aspects, or do we consider the emotional environment as well? Statement number 2 is to build trusting relationships. I will be open and compassionate about each person's unique experiences and establish a trusting relationship by honoring what matters to them and their care partners. How do you establish a trusting relationship? Are we practicing active listening? Do we follow through on what we said we would do to build that trust and show respect? Commitment statement number 3 is to consider all forms of communication. I will develop a strong understanding of the person's health condition and consider verbal and nonverbal means of communication. For example, responsive behaviors, personal expressions, body language, to be forms of meaningful communication. The final of the 4 person-centered language commitment statements is to advocate for person-centered language. I will continuously reflect on and advocate for person-centered language and its potential impacts. I will be open to discussions regarding language choices for myself and others, respectfully challenge those that are not person-centered, and celebrate positive language choices. The knowledge transfer tools that were created to support the Person-Centered Language Initiative include the PCL Toolkit Report, which was released in the fall of 2018 and may be found on both BSO and the Ontario CLRI websites. Feedback from the Person-Centered Language Expert Panel led to the creation of 2 variations of the poster. The first comprehensive version includes additional sentences to describe the actionable commitment statements, whereas the second, more simplified version includes the action statements with a focus on the graphics for those who are more visual. And this version is also useful when displaying smaller sizes of the poster. As you can see here, the posters and pledge certificate are available in both official languages. When you do complete the online pledge, a certificate will be generated in a PDF format that you can proudly print and display, or you can keep on file as well. And so since the fall of 2018, 2,727 pledges have been taken, and the number continues to climb consistently. I will now turn things over to Audra to learn more about the exciting e-learning course.
Thanks, Tina. So in the beginning of 2020, we decided to move forward with the development of an online free e-course that would help people get more acquainted with person-centered language. As Tina mentioned, we worked with McMaster University, specifically with Mac Health, to develop a free self-enrollment course that's open to the public. The course can be accessed through the Mac Health site, along with a variety of other free resources. There are 2 person-centered language courses that were created. The first was geared toward team members working in long-term care, and the second course was offered more to leaders and managers. The e-course is a multimedia e-learning platform that incorporates meaningful scenarios and case-based examples. So users really have the opportunity to learn the information, but then also reflect and contribute back to their learning right within the course. The course takes about 45 minutes, but it is broken into modules. So there are 3 modules. So if you only have time to do one of the modules, you might spend 15 minutes doing that. And then you can save that and move on to another module at another time. The course also includes a certificate of completion. So if you were required to complete the course as part of your orientation in your long-term care home training, you're able to show that course completion certificate to your employers. And we're also very proud to announce that the French language course is underway and it should be released within the next few weeks. So we've been working on the course and it has been available since the spring. And we've already had 500 people register for the course and 400 completions. And we think that this is really important because we haven't spent a lot of time promoting the course. So we do recognize that it's very valuable and word of mouth has spread. We've had a range of different learners. So we've had team members working in long-term care complete the course, but we've also had universities teaching nursing programs have their students complete the course as part of an assignment. So there's a variety of different learners. It doesn't need to be just within long-term care. Obviously, anyone can take the course and benefit from learning more about person-centered language. Initial feedback suggests that 95% of the learners would recommend the course to others, and 96% feel that they can use what they've learned to have a positive impact. Another initiative we've been working on with person-centered language is taking a closer look at the media and considering ways in which we might offer suggestions to how they can change the language being used when describing those living and working in long-term care. We started with a letter to the Canadian Press asking them to change the terminology used within their style guide for new journalists. Our idea was that if we could provide some person-centered language options to replace common words used in the media, it might be a good start. We hope to continue this work moving forward. The next steps with the person-centered language initiatives are to reconvene with the expert panel and establish new goals. We hope to create a comparison language template that can be used among team members. We will continue to onboard post-secondary institutions in the use of person-centered language. We will also be promoting the e-learning modules over the fall and hope that you all have the opportunity to complete them. Next, we hope to create a challenge that will include the distribution of lapel pins to serve as tokens of recognition for the use and celebration of person-centered language. And finally, we will continue to seek feedback and stories from teams across the province in how they are using person-centered language. I invite you now to reflect and commit to one thing you could take away from today's presentation. How can you start implementing person-centered language in your day-to-day life? Perhaps, like in this photo, it's taking and committing to the pledge to use person-centered language. As a reminder, you can access the pledge on the BSO website. Thank you so much for joining our presentation. We hope that you have learned a little bit more about person-centered language and are eager to go and access the courses and other available resources.